Hello everyone today. A very good evening to all of you. Today we are going to discuss the case note of Mr. Darwish Woods. This particular case note was there for the exam on 29th May 2021. So let's go for your position, the writer's position. The writer is a surgical nurse in a post-operative ward, and your patient is due for discharge on the same date, that's on 29th of May, after a coronary artery bypass graft surgery. Now let's see the patient details. The patient name is Mr. Darwish Woods, and 77-year-old married person, but his wife is blind. Daughter is there but lives overseas. So this is the condition. He has a lot of problems, and right now he has the problem of coronary artery disease, which was confirmed by angiogram, stress test, and ECG. And the surgery was off from CABG on 24 of May 2021. That is the case up to now. Let's move further. On 23rd, he got admitted to the hospital, and he got to the surgical table on 24, and the graft was taken from his left leg, stayed in the ICU for the next 24 hours for observation. Next, we after the surgery, we have given him antibiotics, intravenous analgesics, antithrombolytic agents, and you can see this chest tube was there, drainage was just 20 ml, vitals was okay. Okay, you gave him dressing at the graft site, provided elastic stockings, and elevated the leg for 24 hours during his stay there in the ICU. His leg was elevated. So he came on 23rd, the surgery was there on 24. He was there in the ICU for 24 hours, and after the 24 hours, naturally, it becomes 25 of May when he was transferred to the ward. This particular day, his chest tube was removed, and we have seen the wound was normal, within normal limits. Now compliance of pain. No, compliance of pain. Okay, even though his wound was healing, he complained of pain. And where the pain, it's on the chest and shoulder, so that brufen was given. So the problem resolved, and we initiated the physiotherapy, which included deep breathing exercises and walking for 4 to 5 minutes 4 times per day. Exercise date sheet provided to him. Again, the vitals became normal, so we decided for him a discharge. Now, but he need to stay in the rehabilitation unit for the next 3 weeks until the recovery is complete, and we do have a follow-up appointment on 7/6/2021. Okay, so discharge instructions. Yeah, you have to assess the wound. Dressing should be given until the suture removal after 2 weeks. Okay, so we have to continue the deep breathing exercise, walking 4 to 5 minutes and that should be increased gradually. Avoid heavy lifting, arrange carer meals. Why we need to go ahead with this particular thing is that we know that he is supporting his wife. His wife is a registered blind, and she is already in trouble. So right now he has some problems. So we need to arrange the carer. And initially he won't be able to care his wife. Initially he won't be able to cook meals for her. So need to go with these things before he's discharged home. So let's go with the assignment for us. Using the information in the case notes, write a transfer letter to Ms. Smith Brown, head of nursing, Rehabilitation Center, Brisbane, Australia. So let's see the date. It's on 29 May. The date is exact 29 May. And you are addressing to Ms. Smith Brown. The person is here. Head of nursing, yes, head of nursing. Rehabilitation Center, yes, it's there. Brisbane, it's there. 12D is Australia, the pin 4001. Dear Miss Brown, so the surname is used. Reference, the Darwish Woods, aged 77. So Darwish Woods, 77. So let's go with the purpose paragraph. So now onwards, we have to be very careful. Let's see that. I'm writing to request rehabilitation care and support. So you are not going to write further care and management. So if I go with the specifically, I know that this is a rehabilitation center and this care there is rehabilitation care. So to be concise and formal, I use the word rehabilitation care. It includes follow-up care. It includes further care. So that's the best word I can use there, rehabilitation care. I'm writing to request rehabilitation care and support for Mr. Darwish Woods for the next 3 weeks. The purpose is very clear and concise. So what you need from this person, I request Miss Brown rehabilitation care and support for my patient Darwish Woods. For how long? For the next 3 weeks. What happened to him? He's recuperating, he's recovering after a coronary bypass graft. Not most of the students, they may write he's recuperating from or he's recovering from. That's wrong. So he's recovering from a disease condition, but he's not recuperating or recovering from a coronary artery bypass graft. As far as it's a procedure, it's a procedure. We don't use this word from there. We use after the procedure. He's recovering after the procedure and is being transferred to your facility today. So he is transferred. So the letter is a transfer letter. So the word transferred is there clearly. When is he moving? He's moving today. So it's complete, it's concise, it's formal, it's not that much complex. It's understandable to each and every reader who reads it. If I am reading this particular letter, I be getting a clear picture. What, where, who, when, all these things are absolutely answered. So that's the way we need to present the purpose. So full marks to the purpose. Now, I'm moving ahead with the first paragraph. So what was what was the story, how the story begins in the order. It's the story begins on 23rd when he was admitted to a hospital after being diagnosed with the coronary artery disease. Okay, this is somewhere I have to seek your attention from. Oh, this is the thing here. Right now we are staying here. Yeah. So the reason for his admission is coronary artery disease. So how do I present that why he presented to the hospital? Or why he was admitted to the hospital? You are not given that he was admitted to the hospital due to chest pain or discomfort or shortness of breath. These things are not given anywhere here. So I cannot say that he was admitted to the hospital due to discomfort or something. It's not given there. The only thing which is given here is coronary artery disease. So how do I do with that? How do I write that? Can I write Mr. Woods came to the hospital or Mr. Woods was admitted to the hospital with coronary artery disease? No, I cannot, because he came for the treatment for coronary artery disease. So before that, he was diagnosed with these confirmative tests. So I don't have the option to include all these tests here. So where the test was conducted, I don't know. But I know that he was admitted to the hospital on this particular date. So only way I can do here, it's a very complex situation. So the only way I can do is that Mr. Wood was admitted to a hospital on this particular date after being diagnosed with coronary artery disease, for which he underwent the aforementioned procedure. Clear? The aforementioned procedure is a coronary artery bypass graft. So where he was diagnosed, I don't know. What was the test? I don't need to explain all these things here. He was kept under observation in the ICU for the next 24 hours. You can look back and see, you can say admitted in ICU for 24 hours. For what reason he is admitted to the ICU? For observation, for a close monitoring and observation, he got admitted to the ICU. That's why we have presented it there. Post-operatively, he was treated conservatively and stockings were provided to his legs, which was elevated during his ICU stay. So I need to brief up the story here. I don't need explanation for this. This is a past happening. So this is a story, and this story is in very much detail here. So you know that surgery, 24 hours, antibiotic, analgesics, antithrombolytic, drainage, these vitals are there, dressings there, elastics. So I need to brief it up. So I need to I need to cut short, but I should not lose the essence of this thing. The story should be made brief, but I should not miss the relevant data here. I need to convey some important things to the person whom I am writing to. So the important things, 1, 2, these things should be briefed, and yeah, and these things. So what we can say is that instead of antibiotics, analgesics, antithrombolytic, dressing, the grafting, these are conservative treatment after the surgery. So we have written he was treated conservatively after the surgery, and stockings were provided to his leg, which was elevated during his ICU stay. He was there in ICU for 24 hours. So I have not written 24 hours again. So I have said it during his ICU stay. So he stayed in ICU for 24 hours. That's clear there. Now we move on to the next particular thing. Mr. Wood was transferred to the ward on 25 or 23, the next day the surgery. Okay. And here chest tube was removed. His wound appeared to be healing, but he experienced some pain over the chest and shoulder, which was resolved with ibuprofen. Daily physiotherapy was initiated on him, which focused on deep breathing exercise, which has to be continued, and short distance walking for about 5 minutes to be increased gradually. Let's see that in detail. He was transferred to the ward on 25. Is it correct? Yes, on 25. You can see the chest tubes removed, wound was okay, but he complained of pain. This thing was resolved by the administration of ibuprofen. And here we started daily physiotherapy started there, which included deep breathing exercise and walking for about 5 minutes. So this physiotherapy has to be continued. Walking has to be increased. You can see that. Continue deep breathing exercise, walking 4 to 5 minutes, increase gradually. So I combined it here. Daily physiotherapy was initiated on him, which focused on deep breathing exercise. So what happens to deep breathing exercise, which has to be continued? So it should go ahead. And short distance walking for about 5 minutes, 4 to 5 minutes, it's written. So people may write 5 minutes or 4 to 5 minutes. So it's not recommended to write these figures. Instead, you write these things. If it is less than 10, you go ahead with words. Okay. If it is over 10, so 11 or 25 or 250, then you can go with the figures, no issues there. But as far as it is a smaller digit, that say for example 1 2 5 7 8, then you go with the words there. Okay, to be increased. So this has to be continued and this has to be increased gradually. So that is clear there. So we don't need to repeat that in the other paragraph. Now I need to see what is his social history. So you can see that this person is married, his wife is blind, and he has some relevant problems, medical problems. That's it. Okay. So we have written Mr. Woods is the sole carer for his life. Very, very relevant data as far as we have a requirement here. The requirement is arrange carer and meals before discharge to home. Why he needs a carer? Why he needs meals before he's been discharged home? It's because he is the person who is the only carer for his wife. His wife is a blind person and she won't be able to cook and she won't be able to take care of her own activities properly. She needs assistance. So that's why it's very, very important data here. He has been taking regular medication for arthritis, high cholesterol and hypertension. These things are given in the bracket since 2007, 2009 and 2011 respectively. Oh, I just made it brief. I don't have any other option to make the letter word count to be within the limits. It's a very important thing here. We need to keep this word count less. I need to include all these data which I have written already. Was a little bit modified if I go with, because most of the students find it very difficult to manage the word counts. It's a very lengthy letter, a lot of data is there. So I have found this as a method to cut down the number of words. I use the bracket, I used respectively. So in this way, I can cut down the number of words which I tend to use in the letter. Now, what you have to do, it would be appreciated if you could assess and dress the wound regularly for 2 weeks until the suture removal. Yes. So assess and dress the wound 2 weeks until the suture removal. Point number 1, 2, 3, everything is included in one sentence. So this is already mentioned in the previous paragraph. We won't be needing this thing because A is 77-year-old and he won't be lifting anything heavy right now. And this is another thing which is very important there. So let's see. Of note, he needs a carer and the facility for meals prior to discharge. Now, one important thing is missing here, and that is this thing. The follow-up appointment is on 7/6/2021. So I need to add that too in this particular area. So that is the only thing that we need to add there in this particular letter. So you need to add the follow-up data to the letter. So the letter is okay right now. So this is just a sample letter, an acceptable way of writing this particular case note. So don't consider this as a perfect letter. So in case of the presentation, the language, the arrangement you can follow, but don't think that it goes, it's a perfect letter. It's not free from any mistakes. Of course, you might find some mistakes somewhere. Okay, so I hope you understood the format and the way which the presentation is. Thank you one and all. Have a nice day.